will force on the doctor, we want a cesarean. And if you fail to provide, they'll move on to some other doctor who will provide it. So it should not be a patient-controlled one also. Rather, it should be a patient-centric consultation. You should treat the patient thinking in him or her as the center of the treatment plan. Because you have to remember, patient will notice more than what you think. You will feel patient is not noticing, you are talking to somebody else and he will listen to. So they notice a lot. And 2/3 of the communication is not verbal. What you are telling them is one part, but 2/3 part is how you are behaving, what is your body language. So these things do matter. Because a doctor can do as much harm with a slip of a word as with slip of a knife. Because your word is authority. What you are telling to the patient, you have to be very careful, very wise in choosing your words. Because what you are telling to the patient will have a very long term and a positive or negative impact on his health. So having said that, what are the difficulties that comes in a doctor-patient relationship? What you face to build up, what problems you face to build a healthy relationship? Because regardless of what experience you have, how long you have been a doctor, there comes a point in life of a doctor where there is a disruption in the doctor-patient relationship. Doctor will not be happy with a particular patient, or the patient might not be happy with a particular doctor, and that often leads to conflict. But more time it is seen that conflict happens because there is lack in this attendance. What I am saying today should be there throughout the year. Yes. What will happen few days later? You will think, oh, morning class, let's not go. Or particular teacher is boring, he is not teaching well. You should come see, because no matter what, how the doctors from experience, because we bunked a lot of classes, we were in a government college. 2 months bunk, 3 months bunk, that time it will feel very happy. That time we'll feel, oh wow, we can go home, enjoy with our friends and all those things. But when you sit for your PG entrance exam, then you will miss all this. Then you have to study all those things from the book on your own. Then you will understand how difficult it is. So you should have a good knowledge, skill and performance. You should make the patient feel safe. You should give him good quality service. This can be doctor dependent. I mean, the doctor is having a dismissive attitude. Whatever patient is telling doctor, I am having this problem. No, no, no. He is not listening. So you should not have a dismissive attitude. You should not have a hurried approach or lack of time, what she told. You should give time to the patient. Use of jargon means you should not use series of words which a patient will not understand. Like anything, something very technical you are telling to the patient. Ability to speak first language of the patient is one of the very big problems which even I faced, because before this I was working in Kerala. I am not a native of Kerala, so Malayalam I don't know. So whenever a patient used to come, he is trying to talk in Malayalam, I don't know. So again, it creates a lot of problems. So you should know the first language of the patient, and you should try to get an insight into the patient's background. So when a patient comes, directly don't jump to, okay, what problem you have. First you have to ask his name, then you have to ask his occupation, because see, this gives a lot of insight into the patient's desires. What a patient wants, you can infer from these things. Suppose he is very educated, he is a computer engineer, so things might mean different for him than suppose a patient is a laborer class or somebody else. So always spend time in asking for the cultural background, socioeconomic status and all those things. Something which he or she can afford. Then the barriers can also be patient dependent. They are very anxious when they come to you, of course, so they might not be able to tell you the correct problem. It is our duty to extract the information from them. So you have to make them feel very safe. You have to make them feel very, concerned. You have to be concerned. You have to be a good listener. Then there might be very sensitive issues which they might or may not want to discuss with you. Also, a lot of patients have a lot of misconception. You will tell, wash the wound, they will feel, oh, putting water will spoil the wound, or eating tomato or citrus thing will lead to non-healing of the wound. So they might have misconception. There might be some cognitive impairment, means he might not be mentally fit to understand what you are telling. There might be a hearing, speech and visual impairment, and you have to take all these into account to help. See, because the patient is coming to you, it's not just your duty to blurt out something whether he is understanding or not. You have to make sure whatever you are telling to the patient is getting to him. Then there can be barriers which are dependent on health system. Means you might not be having a particular facility for a particular branch or a particular specialty that might hamper the thing. And doctor-patient mismatch also, of course, is one of the big problems. So what is the solution for these problems? You have to recognize early and you have to repair the disease. You have to repair this relationship. So what happens whenever there is a negative outcome or there is a misunderstanding between that part of the treatment may not have gone according to the plan, may not have gone according to the treatment, or has been some problem. Because see, most of the time what happens, if you accept something, take charge of a problem, talk to the patient, say you are sorry, or make sure, suppose the patient had a bad experience waiting for a long time, or some particular lower staff, a sister or ward boy has mishandled them. If you ask sorry on their part, explain it will not happen again, they feel very positive. These things will make the patient loyal to you. What will happen? Suppose really something goes wrong in the future, they will be ready to forgive you for that. But if you are not making these basic precautions, basic steps, if you are not taking this to build a good relationship, these things might be very difficult to understand. So solution is you have to be active listener. Verbal, non-verbal communication should be there. You should make eye contact with the patient. You should have empathy. You should educate the patient. Tell what they are suffering from. What is the course of disease? What is expected out of the disease? And you should reassure the patient that you are there for them. You are there to help them in any way you can. Also, you should agree on a treatment plan. See, just merely telling something, do this. If patient is not agreeing, doesn't end your responsibility. A lot of time happens, patient comes, you tell this has to be done. He says, doctor, I can't do this. You say, then go to it. Don't come to me again. Come when you are ready. So they should not be there. If suppose patient is not agreeing on a treatment plan, you have to find a way. Either try to explain to him why you insist on is not his or her domain. So you have to establish a boundary. You have to tell them what they know. For many years, I have so much of experience. What will this do? This will help the patient to have some positive attitude towards yourself. Then you have to acknowledge the patient also. Mr. Rajesh, how are you feeling? How are you? Talking to the patient by their name builds a good trust. Suppose you are not talking to the patient, हाँ भाई बताओ कौन हो तुम, क्या काम है? What they will feel, the doctor doesn't even know me or he doesn't even know my name. Then of course you have to listen, which we have talked. Then you have to explain to the patient in their local language, in their first language, what you have to explain the treatment, investigation. Not just that, but you have to explain the cost, how much cost will be incurred during the treatment cost, what will be the duration. Everything has to be explained to the patient because when they come, there are three problems which the patient wants to know. Whether a disease which he or she is suffering from will get cured or not. Second, what will be the cost of the treatment. And third, what will be the amount of time he is looking for. Whether it will take 1 month time, 2 months time. So you should explain all these things to the patient. Then here comes a very important part, you have to review the patient. After explaining everything, you have to ask the patient what you have understood. What happens if you will keep on telling, he will keep on saying yes, 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 yes. When he goes home, he will forget half of the things, he will make mistakes. So after you have explained everything, you have to talk to the patient, you have to ask him back what you have understood. Suppose you are telling, don't walk, keep your leg up, elevate your hand, do daily dressing. Suppose 10 things you are telling, he will say, okay, okay. But later he will go, he will say, doctor, you said not to do daily dressing, or you have asked us not to wash. So first you have to tell, then you have to ask, tell me what you have explained, what you have understood. And you have to thank you. See, it's not duty of the patient. Sometimes doctor feels it's me who is treating the patient. Doctor should say thank you before doing. It's not that. Doctor should